7:45. Human sex trafficking is a multi-billion-dollar-a-year industry which is on the rise in all 50 states. A recent report by the U.S. State Department showed that the United States was once again ranked as one of the worst in the countries in the world for human trafficking, and that trafficking is expected to surpass the illegal sales of arms and drugs all within the next few years. It's just startling to hear this. So there's a local hospital that's working to combat the problem. Laura Clary is the clinical program manager for GBMC SAFE program. She's joining us this morning. Good morning.
Good morning.
All of that is a mouthful, and it's just heart-wrenching to hear that. What is the SAFE program?
So the SAFE program at GBMC stands for Sexual Assault Forensic Examination, and what we do is we care for victims of sexual assault, child physical and sexual abuse, human trafficking, and domestic violence, and we provide nursing and advocacy services.
We're talking about the numbers of these incidents on the rise. How prevalent is it here in our region, in our community, and why is it able to happen?
So I think people are really surprised to hear that it's so prevalent in Baltimore, mainly because they're used to seeing what you see in entertainment, different movies that are showing that it's only happening overseas, but yeah. Actually, Baltimore is a hub for human trafficking, mainly because we are a port city. We can be reached by water, by land, and by air, and we have the I-95 corridor that goes straight through Baltimore, so it's really easy to transport people up and down that I-95 corridor.
So healthcare providers like GBMC, you all are taking a frontline approach to being able to be part of the solution. What do you all do?
So a lot of the studies are showing that victims of trafficking are more likely to come into a healthcare facility than to go to the police or to other agencies. Some studies show that up to 85% of victims will seek healthcare treatment at some point while they're being trafficked, and about 63% of those are actually coming in through the emergency department. So making sure that we are educating our frontline emergency department, healthcare providers, the doctors, the nurses, and even registration. Everybody should be on board with knowing what the signs are and recognizing those signs.
Which are what? Because you know, that might be beneficial for just anybody who comes across this. What are those signs?
So what we look for is when a patient comes in and they may have somebody with them that's incredibly overbearing, not letting them answer their own questions. We've had patients come in that have given the wrong name or the wrong birth date because they're afraid of being identified. We look for patients that are very connected to their cell phone because that cell phone, their life depends on it. So they're very resistant to putting down their cell phone during their treatment. And then there's certain medical things that we look for through the nursing side as well.
You all are so involved in working out solutions that you all were part of a conference just recently this week that you all presented some information to the region.
Mm-hmm. So we were invited to come down to Washington, D.C. and present about the healthcare response to human trafficking. We actually developed one of the first policies in Baltimore County on how to respond to human trafficking in the healthcare environment, and as well as mandatory training for all of the nurses in GBMC. And they recognized that we're kind of ahead of the game when it comes to making sure that hospitals know how to respond to this really important issue. So we were invited down to talk about what we're doing in healthcare and how we can combat this issue from the healthcare standpoint.
Well, I thank you for coming in to talk about it, and thank you for the work that you guys are doing.
Thank you so much.
All right, well, it is 7:48 now.